Hello, my name is Spyridon Kazanopoulos, and I am a PhD candidate at the University of the Basque Country in Spain. The title of my presentation is Teachers' Self-Efficacy for Inclusive Practices at Greek Secondary Schools. The work I will present to you was approved and published in the high-indexed international journal Education Sciences, which is EHU Skopos. Teachers' self-efficacy is essential for effective teaching and is determined by the set of beliefs a teacher has about his or her own abilities and skills to teach and influence student behavior and aspirations, regardless of external influences or obstacles. The main objective of the current study is to examine special and general education teachers' self-efficacy for inclusive practices at the Greek secondary education schools and how teachers' age, gender, teaching experience, and training affect their self-efficacy for inclusive practices. The research questions are formulated below. The first research question is, what is special and general education teachers' self-efficacy for inclusive practices at the Greek secondary education schools? And the second research question is, how do teachers' age, gender, teaching experience, and training affect their self-efficacy for inclusive practices? The methodology. The survey was conducted from December 22 to March 21 when the country was in lockdown conditions. The questionnaires were distributed electronically to all education departments in Greece. A sample was conducted by 265 teachers of Greek high schools, almost equally distributed to teachers of general and special education, as well as to permanent and deputy teachers. A primary quantitative correlation study between groups in a non-experimental design was accomplished. The questionnaire for the current study consisted of 29 questions and 2 sections. The first section refers to demographic characteristics. The second section involves 18 Likert type of teachers' efficacy for inclusive practices tape scale. The data were analyzed in IABM SPSS 24, and the variables were analyzed using the mean and standard deviation. Independent samples t-test was used to compare mean difference between 2 large independent samples. One-way ANOVA was used to compare mean differences between 3 or more independent samples, and cross-cal wireless test was used to compare mean runs for 3 or more independent samples. Post-Hoc Analysis Bonferroni was used in multiple comparisons of cases where the cross-cal wireless test was significant. And the reliability of data was tested using the Cronbach alpha coefficient, and it was found greater than 0.7. The results. Teachers in the current study presented high efficiency in using inclusive instructions. In particular, they were able to come up with an alternative explanation for students who were confused and set the right challenges for very capable students. In addition, they indicated a high capability to get students to work together in pairs or in small groups and accurately gauge students' comprehension of what they have taught, as well to use a variety of assessment strategies and design learning tasks so that the individual needs of students with disabilities are accommodated. Furthermore, high levels of efficacy for collaborating appeared. Teachers stated that they can collaborate with other professionals in designing education plans for students with disabilities, work jointly with other professionals and staff to teach students with disabilities in the classroom, make parents feel comfortable coming to school, and assist families in helping their children do well in school. teachers indicated a high ability to deal with disruptive behaviors. In particular, they expressed the capability to get children to follow classroom rules, make their expectations clear about student behavior, control disruptive behavior in the classroom, and calm a student who is disruptive or noisy. The study revealed that age, gender, and teaching experience in general education was not significant factors in shaping self-efficacy towards inclusive practices, and training was considered a significant factor that affected attitudes on self-efficacy towards inclusive practices. Teachers who are trained in special education or have at least one kind of training or have participated in a conference presented higher levels of efficacy to use inclusive instructions, collaborate, and to deal with disruptive behaviors. Conclusions. Results indicated that teachers of special education presented higher efficacy in using inclusive instructions, collaborating, and dealing with disruptive behaviors. The training was considered a significant factor that affected attitudes of self-efficacy towards inclusive practice. The findings of the research reinforced the need for more teachers' training and the development of their confidence in the implementation of inclusive practices in secondary schools. In addition, policymakers could consider developing more training programs for in-service teachers to help them get acquainted with the most effective inclusive teaching practices. Thank you for your attention.